thank you very much for agreeing to talk with me today. Could you just start by introducing yourself and telling me a bit about your life and where you're from, where you live?
My name's Dionne. I'm from Edinburgh in Scotland. I'm 24 years old. I work part-time. I've also got a condition called endometriosis, which I raise a lot of awareness about, like an advocate for women's health. It's an area that really interests me.
Yeah, so you just mentioned that you have endometriosis and you talk about that on your page. And you also, as well as having endometriosis, you use catheters as well. Would you be willing to talk a bit about your journey with endometriosis and kind of briefly break down what it is for maybe people that don't know?
So I'd always had sort of bad periods when when I first started them. They were painful, the bleeding was heavy. It was enough to kind of make me vomit, and it was really uncomfortable going to the toilet. Like, I'd went to the doctors and they just sort of said it's just a bad period, it's normal. You're told every woman has it, every woman goes through the pain and it should just get better as you get older. But mine was just getting worse, and every month it was just crippling pain. The symptoms were so debilitating. It would mean that I would sometimes have to get sent home from school just because things like paracetamol wasn't touching the pain at all. I went to the GP and they put me on the pill because they thought stopping the periods would stop the pain. But they tried me on different types of pills, but everything comes with side effects. So we pushed for the gynae referral. It took a couple of years, but they finally referred me. My first appointment, they sort of seen it as period pain, and they sent me away with different hormones to try. It was just going back every 3 months and saying to them, look, this isn't working. Again, it was sort of painkillers, just trying to kind of manage the symptoms that way. It was about, I'd say about 6 years later, they finally agreed to do laparoscopy. So that's when they do a keyhole surgery, and they'll just look inside the abdomen and diagnose what the problem is. I remember waking up from that surgery and they told me that I had endometriosis. I mean, at that point I knew nothing about I didn't know what it was about or what it was. And you're having to sort of Google, which is probably the worst. You see all these horror stories, but Googling what it was and how it impacts on you. So it's basically like when tissue that's meant to sort of grow in the uterus, it grows outside it, and it can sort of migrate to other parts of the body. So when I'd had my first laparoscopy, they said to me that it was on the back of the womb and it was on my bowel. They said to me they could remove some, but not all. And they said, right, it's a bit more complex. You're going to need to have further surgery. After that, I just continued having pain. It was like pain going to the toilet. I had issues with my bladder. I've had 4 surgeries for the condition, and I'm due to have a hysterectomy in 2 weeks' time. I mean, my pain's sort of constant. It sort of brings bladder and bowel issues. It's nausea, vomiting, just being stuck in bed all the time, and just not being able to kind of socialise because you're having to cancel plans, and it does deflate you. It does make you feel really deflated. I started sort of having issues with my bladder, and it started off with it was like symptoms of having an overactive bladder. They put me on medication, but then I started taking sort of urine infections. It was like every month, and it was kind of going with my menstrual cycle. Obviously, from that perspective, it was trying to manage the symptoms by just giving me antibiotics for the infection and treating them sort of as they happen. So I was referred again to urology. I remember it was during the pandemic, it was the start of it. I'd went into retention and I couldn't pee at all. So I went to got sent to the surgical assessment unit. They put a catheter in and they drained, I think it was 700 ml. So they left the catheter in, so I had it for a good couple of weeks just to give the bladder a bit of a rest. And then they took it out and things were sort of okay, I was passing urine, but I was getting the sensation that I wasn't fully emptying. So obviously with COVID and things, appointments were getting cancelled, so I was kind of affected by that. I'd went into retention a second time and had to be sent to the hospital again. they seen me and they were sort of saying, right, there's only like, there wasn't very much in the bladder, but it did feel like it was full. I was then seen by the urogynae nurse and she sort of said, right, go to the toilet normally and then we'll come back and I'll show you how to put a catheter. And I'm thinking, oh my God, I'm doing this myself. Like, going through your head, it's like, what if I do it wrong? The nurses obviously showed me and they drained my bladder and it was like there was an extra another 500 in there.
Oh.
So she was like, right, you're not emptying properly. You're going to have to start self-catheterising. It was all kind of strange at first, but I suppose as well you kind of do adapt to it. She'd shown me like a range of there was two different catheters that she said, try both, see which one you feel more comfortable with. I was sort of put forward for urodynamics. So we're trying to kind of work out what was sort of going on with my bladder in terms of, is it neuropathic? So they done that test and they could see that I wasn't able to void myself. They came to the conclusion that basically the endometriosis has impacted on the nerves in my bladder. So it's impacting on me having the ability to pass urine myself. It's having to sort of catheterise each time I go to the toilet. I mean, I've been doing it now for, it'll be about 2 years, I think it'll be coming up. It was all overwhelming at first, but now it's kind of just been adapted into day to day.
Obviously, you just spoke about catheters. As someone that needs to self-catheterise, like, is there something that you want others to know about catheters or intermittent self-catheterisation? Because obviously it's mostly associated with the kind of older generation and not always with people like yourself who are 24, young.
A lot of the information that I got was sort of for like patients with catheters, it's older people. And I just sort of thought, well, I'm really young, like, I can't be the only one with endometriosis sort of dealing with this sort of symptom. I kind of started posting about on Instagram and I was really surprised. Like, I got different messages from quite a lot of people saying, I have to do this because of endometriosis too. And in a way, like, it was good to meet others that could sort of say, look, I'm with you, I understand. And just sort of being able to relate to someone as well. People think like it's a sort of taboo topic. It's not something everyone talks about, but we need to normalise conversations like this. It's okay to talk about your bladder and the issues you have with it. Sharing as well, it sort of helps in a way because you're raising awareness of being young and having sort of a chronic illness and catheterising due to it.
Like you said, endometriosis and the bladder and bladder issues aren't really spoken about a lot and they're not often put together. But I've spoken to a lot of people that have said, like you, that they've had issues with their bladder from endometriosis. So why do you think that's not more widely spoken about?
I've had sort of experiences where it was mostly when I went to see one of the endometriosis specialists and they associate bladder with urology when you're sort of sitting thinking, look, I've got this condition, it's complex, so it should really be like a multidisciplinary approach. As a support group, we did like sort of some research into the bladder and endometriosis and quite a lot of people were saying, I get symptoms and some people aren't having to catheterise, but they're having issues with like infection. And I've been to the gynaecologist and they've said, I'm just going to send you to urology because we don't deal with that. We're just the reproductive organs. You just sort of sit and you think, actually, this should be something that everyone talks about. Like, bladder health is so important and it's not something that people kind of see as a sort of priority. But when something like sort of the ability to not pass urine, like yourself, you do realise like it is a big thing. It's a sort of human right to be able to pass urine yourself.
Yeah, of course, and do it safely and with dignity and stuff. Yeah. So you just mentioned the support group. Was that one you found online, or is that one you found through a charity? Or
so we're an independent support group. We're called Endo Warriors Wesleyan. I met the girls. I remember I found it on Instagram that they ran like a support group, and I remember going to that meeting, like just meeting the two girls, and there was quite a few of us in that meeting, and you're sort of sitting there, and then they're like, right, share your story. Everybody was kind of going through the same thing. Everybody was so supportive, so we started doing a lot of kind of awareness raising. I took on the role of a senior admin, so I did a lot of like supporting other people. We met with sort of like Scottish Government, we did quite a lot of local stuff as well. We did quite a lot of fundraising for the Endometriosis Centre in Edinburgh. So we've been kind of raising money to sort of fundraise for research and that sort of thing. And then the girls asked me to become a group leader. So we've been having sort of like due to COVID, our meetings have mostly been over Zoom or Teams. So we try and kind of run sort of meetings regularly. We've got a support group on Facebook, so it's like a private group. So you sort of request to join, and we do get posts every day from people, and there has been a sort of common theme with bladder. We noticed that like the sort of amount of posts that were coming in were all sort of bladder. That was probably the most that we were getting sort of people asking for support with. I think we're sitting at like 600 and something members. We've got Instagram, we've got Twitter, TikTok, we're on sort of social media, and I think we're just trying to get the word out and say to people, look, there is support out there. I've noticed that we've had a lot of younger girls in the group, so I think the youngest is maybe about 17. They're just starting their journey with endometriosis. They've just been diagnosed or they're having symptoms and going through that process. You get that sort of satisfaction from, supporting them. Like, it's really rewarding, because you don't want anybody to have to go through this on their own.
No, and especially as the kind of diagnosis for endometriosis can take up to 10 years. I think that's gone down now, but it's trying to get that down, isn't it? Endometriosis is sort of finally getting into the public sphere more and more. There was a documentary last week, I think, or week before on Channel 5. It's good because obviously discussions around women's health has been very minimal for so many years. And do you think we're finally making progress in terms of this? And if not, how much further, or if so, how much further can we go?
I think the good thing is, I've come, a lot of people with endometriosis are actually being open about it and talking about it. I know quite a few people have been in the news. We've got Instagram pages to just kind of get the word out there. But social media's got a big thing for awareness raising. There's just so much on social media now about endometriosis. Some places are kind of for March, for Awareness Month, quite a lot of places were sort of using that as a platform to sort of talk about it, and you do sort of meet a lot of people through that. We're kind of making progress in terms of the awareness amongst the GPs. It's a hit or miss. Some people are having different experiences with their GP, but I think for me, I've been really lucky because my GPs have been really good in terms of helping me manage the symptoms. I've had some where it's they don't really know much about endometriosis, but they'll go away and learn about it so they know how to best support. So we're making progress in that sense, because there's trying to get menstrual wellbeing into the curriculum in education as well. We've had sort of cabinet ministers and stuff that have been willing to meet with us and just talk about these sort of things. And we've had the MP from Livingston. We've been speaking to her about the bladder side and how we feel that it needs to be kind of spoken about more, and there's issues that we've raised that we think, right, this needs to be looked into. But I think we are making progress, definitely.
And obviously, I think you mentioned it before, but obviously living with a chronic health condition, what is kind of one thing you want others to know about what that's like? You mentioned briefly about socialising being difficult, things like that. Yeah, if you just want to speak a bit about that, that would be great.
I think for me, it's sort of saying to people it's okay to sort of say no. If you're having to cancel plans, you need to take the time to put yourself first when you've got a chronic illness. It's okay to have a day where you want to rest, and it will be you're on a roller coaster. You have good days, you have bad days. But I think as well, it's just knowing that support is so important, and there's always somebody that you can speak to. You don't need to kind of go through it on your own.
Yeah, brilliant. I mean, that leads on to my next question. You kind of said that. Do you have any tips for anyone starting out with intermittent self-catheterisation and or endometriosis?
I think in terms of catheterising, when you kind of have that initial appointment where you're kind of discussing it write down questions that you have for your sort of gynae nurse or consultant. It's okay to ask questions, you know, because you kind of go into that appointment and you're sort of thinking all this information overload. But beforehand, sitting down and actually writing down, right, this is what I want to ask, and going into that appointment to like prepared for the consultation. It is overwhelming at first, but you know, it does get easier. Like, it's normal, it's okay to be nervous and scared about it because, you know, that's their normal feelings. And in terms of endometriosis, you know your body better than anyone. If you're not being listened to, you know, keep pushing for answers, even if it means getting a second opinion. Keeping a diary, I would say, as well. It's important to kind of keep a log of symptoms that you're having because it is really helpful for going into an appointment and you're kind of saying, look, this is what I'm experiencing. Because you're just, you know your own body, and if something just isn't right, then it's just about keep pushing until you get an answer.
You also mentioned on your page a bit about invisible disabilities and kind of non-visible disabilities. Could you briefly explain what that is and why it's important that it's being spoken about more?
I think as well, like, people would associate like illness with like you're able to see it, but you could meet someone in the street that could have endometriosis or, you know, another condition, and you know they look fine, they're walking about. You know, it's like someone said to me, it was a couple of weeks ago, but you're always so bubbly when I see you, and we don't see that side where, you know, you suffer. It's an invisible condition that people just can't see. Like, they can't see how much pain you're in. The way we'd sort of describe endometriosis, like, have a barbed wire around the sort of pelvic area, but they don't see that. It's all inside. People just assume like you must be okay because you're not in hospital or you're not like crippled over in pain. I think people kind of try and they can't obviously see it, so they don't think it's that bad. You know, it really can be, and some people it can be so debilitating.
Just to kind of speak about something other than your health, what do you love to do? Is there anything? Do you have any hobbies? Do you like to watch things? What kind of things help calm you down?
So if I'm having sort of like a bad day, like spending time with family and friends, it's just nice to be around people that understand and that are supportive. I've got a dog, so she's a huge support in terms of sort of the bad days. Like, that's like she kind of knows she'll be stuck by my side, like lying at the bottom of the bed, or I like taking her out walks. It's just nice to have that sort of time where you're in the fresh air. She's in a routine now, so every night, for example, we go out, so she's there at the same time every night, wanting a walk. I like watching sort of Netflix. I mean, I'll watch sort of series on that. Quite like reading, so sometimes just lying in bed reading a book can be quite good, and doing sort of like puzzles and colouring in.
Yeah, mindful things. What's your dog's name?
My dog's called Bonnie. She's a Yorkshire Terrier, and she's 14 years old. She's probably got me through some of the worst times with endometriosis.
And then in terms of your Instagram page, you've got a great following there now. Where can people find you? Like, what is your handle, and do you have any goals in terms of your page?
So you can find me on Instagram. It's endowarrior_x. I sort of made that page at first. It was more just for me to document. It was trying to help me kind of cope with everything. But then all of a sudden I thought, actually, nobody talks about endometriosis. And I sort of thought, right, let's post a bit more, just kind of see where it got. And then obviously the followers just grew. And I sort of said, you know, I'm going to document the reality of the condition. I know some people are like, but you're putting yourself out there, but it's so important to raise awareness. My goal is, you know, even if there's somebody that's having symptoms, it's just sort of them feeling validated. I suppose it's supporting other people and trying to help others as well. I'm sort of on that journey, whereas someone could just be starting. It's giving people that space to just talk openly about it, and just having that sort of place where they can reach out if they want support, or just have someone that understands, really.
Yeah. Oh, brilliant. That's fab. And great as well. I feel like there's a lot more kind of young people putting themselves out there and speaking about these things, which is really helpful for everyone. So yeah, thank you so much. This has been great.